Matlock here, back with the Heartz of Matlock vlog. This is part 2 of heart diseases. So the first video we did symptoms. This video we're going to do the causes, and the risk factors of those different heart diseases. So heart disease is easier to treat when detected early. So you always want to speak with your PCP, which is your primary care physician, just about any irregularities that you have in your body or anything you feel that is off with your body, especially when it comes to your heart. So chest pain, shortness of breath, things of that nature. All different type of symptoms, we covered in the first video. So heart disease causes depend on the specific type of heart disease. So for causes of coronary artery disease, it's a buildup of fatty plaques in the arteries is the most common cause of coronary artery disease. Risk factors include a poor diet, lack of exercise, obesity, and smoking. Healthy life choices can help lower the risk of coronary artery disease. Causes of irregular heartbeats. Common causes that can lead to them include cardiomyopathy, coronary artery disease, diabetes, drug misuse, emotional distress, excessive use of alcohol, caffeine, heart problem persistent at birth, congenital heart defects, high blood pressure, smoking, heart valve disease, use of certain medications, including those bought without a prescription, and herbs and supplements. Causes of congenital heart defects. So congenital means this is something that you were born with. In my case, like I spoke previous videos, I was born with a SMAD3 gene, which is linked to heart valve issues in your aorta valve issues. So I was born with that gene, knew nothing about it, found out, of course, at the age of 33 is when I found out anything about my heart issue, and eventually had surgery. So congenital heart defect develops while a baby is growing in the womb. A congenital heart defect forms as the baby's heart develops about a month after conception. Congenital heart defects change the flow of the blood in the heart. Some medical conditions, medications, and genes increase the risk of heart defects. So those genes, which we split between our mother and father, those genes can lead to congenital heart defects. Causes of a thickened or enlarged heart muscle. Cardiomyopathy. So the cause of cardiomyopathy depends on the type. So you have dilated cardiomyopathy. This cause, most common type of cardiomyopathy, often is unknown. May be passed down through families, inherited. Dilated cardiomyopathy typically starts in the heart's main pumping chamber, your left ventricle. Many things can cause damage to the left ventricle, including heart attacks, infections, toxins, and some drugs, including cancer medicines. Hypertrophic cardiomyopathy. This type is usually passed down through families, inherited, and then you have restrictive cardiomyopathy. This is the least common type of cardiomyopathy. It can occur for no known reason at all. Sometimes it's caused by buildup of protein called amyloid in the heart, excuse me if I'm mispronouncing that, or connective tissue disorders. Causes of heart infection. Heart infection, such as endocarditis, occurs when germs reach the heart or heart valves. The most common causes of heart infections are bacteria, viruses, and parasites. Causes of heart valve disease. Many things can cause diseases of the heart valves. Some people are born with heart valve disease, congenital heart valve disease. Heart valve disease may also be caused by conditions such as infectious endocarditis, connective tissue disorders, or rheumatic fever. So risk factors. There are quite a few different risk factors. I will name a few, but I won't read like the definition of these risk factors. Of course, all of this is out on the Mayo Clinic or CDC websites. You can find these factual information. So some risk factors for heart disease include age, sex, family history, high cholesterol, stress, and many more. So complications that you can have from heart disease: heart failure, heart attack, stroke, aneurysm, sudden cardiac arrest, peripheral artery disease. So most importantly is if you are feeling any indifference in your body, any changes in your body, one week to the next, one day to the next, just a consistent feeling of different things going on that normally your body, you wouldn't feel that. Please see your primary care physician. Express your concerns, express your desires to be tested for a lot of different things, because a lot of times we don't know what's going on inside our bodies. Of course, we're not in there. We don't know what's underneath inside our bodies. We don't know what's going on. So the only way to get that insight is to let your physician know, and then some testing and blood work, things of that nature, will get scheduled and be ran, and you can find out if you have any issues. Please be kind in the world, be great, have a heart, show love. Peace.